Kia ora and welcome. Whether you're new to New Zealand or have been living here for a while, this video will help you to understand the New Zealand health and disability system and the types of health and disability services available. I will share information about how to enrol with a family doctor or general practitioner called a GP, and why that's important for your health and the health of your family. The services available in primary care, which is where family doctors are found, and in secondary care, such as specialists, and when to use the public hospital and other services in the community. I hope you can use the information to access the right services for you and your family at the right time and close to home. Health and disability services in New Zealand may work quite differently from other health systems in other countries where you may have lived. So please listen carefully so you can better understand and know how to best use the New Zealand system to meet your needs. The Ministry of Health, or MOH, provides national policy and funding. It also oversees and funds 20 district health boards, also called DHBs, across the country. And there are 3 in the Auckland metro region. They are the Watamata DHB in the north and west areas of Auckland, Auckland DHB in the central Auckland area, and Counties Manukau DHB in the south and southeast areas of Auckland. DHBs are responsible for providing health services, for example, public hospitals, as well as local planning and funding of other health services. What that means is they fund primary health organisations, also called PHOs, to provide care to their local communities, mostly through general practices, also called medical centres, found in the community close to where you may live, study or work. DHBs also provide community healthcare such as community mental health services. You can look at the health system in 2 parts, primary and secondary healthcare. Primary healthcare includes the family doctor, dentists, pharmacists, allied health such as physiotherapists, podiatrists, counselling and other related services. Secondary healthcare is that found within the hospital system, which can be either public or private. You can also see specialists in the hospital environment who work in the community as well. A family doctor or GP is part of the primary health team and is a doctor who looks after the health of your family. This is the most important person you should see for your health in New Zealand. Your family doctor is the first person you should visit if you are worried about your health or the health of your family. Family doctors are found at a medical centre, usually close to where you live. A family doctor can also help you find specialist services at hospitals in secondary care and other health services in the community. A practice nurse is another important primary health professional who works as a team with the doctor and provides a number of services. In New Zealand, the number to call if there is an emergency is 111 for ambulance, fire and police. If you need language support, you can receive free access to trained interpreters when you visit your local family doctor, public hospital or other public health services. In New Zealand, the Ministry of Health, through the District Health Boards, DHBs, heavily subsidises health services if you're eligible. To be eligible for publicly funded health and disability services, you need to be a New Zealand or Australian citizen, a New Zealand permanent resident, hold a continuous work visa for 2 years or more, or a refugee and protected persons. If you do not meet the eligibility criteria, you will have to pay for medical services, but you will not be refused emergency care if you cannot pay. Check first if you are eligible. You can go to the Ministry of Health website. If you're an international student, you will not be eligible and it is compulsory for you to take out medical insurance if you are working or studying here in New Zealand. So how can a local family doctor help you? There are a range of services offered at a medical centre or general practice. They are listed here. Don't forget to bring your medical records from the other countries where you have lived to share with your family doctor and paperwork to prove eligibility for cheaper fees if you enroll at that medical centre. Now we know what a family doctor offers in a medical centre, why should we enroll? First, you can get cheaper doctor visits and lower costs on prescription medications. Enrolling a baby early can help them get access to all available services as well. Remember, enrolment is voluntary. It is your choice to enroll or register with a family doctor that suits you and your family's needs. Just so you know, enrolment is different to registering with a family doctor. If you do not enroll but only register with a doctor, you will be charged a higher fee, so it's important to enroll with a medical centre that you're happy with. Enrolment is only available to those who are eligible. If you are an international student, you will not be eligible to enroll, but you can register with a family doctor. You'll also need to be covered by medical insurance to pay for the doctor's treatment and other health services. So where can you find a family doctor? Firstly, visit HealthPoint website to find a GP close to where you live or for your preferred language. You can ring your local Citizens Advice Bureau, CAB, near where you live, study or work. Get help in one of more than 20 languages at CAB Language Link. You could ask your friends or your family or your ethnic specific association might be able to help. And if you're a university student, you can register with your student health, wellbeing and counselling centre. The quickest way to make an appointment is by phone. Mention your language if you need language support, for example Korean, and a free interpreter can be arranged. When you go to your appointment, present your student ID card if you're a student. You'll need to pay for the cost of a GP visit even though you may be eligible for cheaper fees and other private services. Each private clinic charges differently. If you're an international student, the cost of most services will be covered by your medical insurance. However, some services may not be covered. You will need to check with your insurer first before you use that service. Once you visit the service, you will be charged and you will be asked to either pay for your visit, which you can then claim back from your insurer, or some universities will have a process where they will look after the paperwork for you if you're using their preferred insurer. Remember, if you leave the country, let your medical practice know first. In New Zealand, all major towns have a public hospital. There are 4 main public hospitals in the Auckland Metro region: North Shore Hospital in the north, Waitakere Hospital in the west, Auckland City Hospital in the central area, and Middlemore Hospital in the south of Auckland. If you need to see a specialist for further examination at a hospital through the public health system, your regular family doctor will arrange an appointment, also called a referral. You will go on a waiting list and can wait up to several months before getting an appointment unless it's an emergency. You cannot self-refer to see a specialist. You must see your regular family doctor first. You will get a letter with an appointment date and time. Most hospitals expect you to ring and confirm the appointment. Public hospitals have free interpreting services. When you confirm your appointment, check that an interpreter has been booked for your language. There is no cost for attending a public hospital if you're eligible. If you're not eligible, you will have to pay for your visit. Not all services are provided by the public hospital. If your family doctor arranges a private service for you, there will be a cost which may start from $150 or higher for a first consultation. If you want to see a specialist earlier and do not want to wait in the public health system, your regular family doctor can arrange a referral for you, but you will have to pay a similar cost. If you cannot walk or drive, or when you have an accident, go to your nearest accident and medical clinic, also called an A&M, or urgent care clinic, or the emergency department, ED, for urgent assessment and treatment. In New Zealand, we consider these following symptoms as an emergency. The emergency department also treats serious wounds, broken bones, You can also go to an accident and medical clinic to treat this, accidental poisoning or overdose of medication, drugs and other injuries. If you think it's an emergency, then call an ambulance, dial 111. You may need to pay part of the cost. In New Zealand, the ambulance service is provided by St John Ambulance. It is a charitable organisation which doesn't belong to any hospital or government department. Hospital emergency services operate 24/7. You can visit the emergency department without a family doctor referral if it's an emergency situation. There may be long waits as staff prioritise urgent need. Where to go for urgent and non-serious illness? If you become ill and you feel it's urgent but less serious, visit your regular family doctor first. If you cannot get an appointment or the medical centre is closed, go to a private urgent care clinic or accident and medical centre known as A&M. There will be higher costs charged to use this service, but it's worth it if you need care and it's not an emergency. If they are unable to treat your illness or injury, they will refer you to a hospital emergency department called ED if you need emergency care. It's a good idea to know where the nearest private urgent care clinic or A&M is. If you call your regular medical centre, they can tell you over the phone if they are open. If they are closed, you will be put through to the telephone triage service. What that means is that you can speak to a nurse to give you health advice and to find out where the nearest urgent care clinic or A&M is and their opening hours. If you are still unsure about your health or your family's health and need health advice, you can call the Healthline number. Healthline is a government-free telephone advice service. Trained, registered nurses can talk with you if you're feeling unwell but not sure whether you need to see a doctor or need some urgent advice about a family member or a friend who's sick. They can also arrange an interpreter if you need language support. The service is free, confidential and is available 24 hours, 7 days. If you or a family member need language support, you can ask for a trained interpreter when you visit a public hospital, your family doctor, and in most other public health services. In most cases, it's free of charge, and you can ask for either face-to-face or phone interpreting in medical centres and public hospitals, but check first when booking or confirming your appointment about the options. Tell your medical centre which language you want, for example, Korean, before you book your appointment or when you confirm your specialist appointment. You don't need to worry, confidentiality is a priority for all interpreters. If you bring family members and friends to your appointments, use them for support but not as interpreters. And remember, it is your right to ask for an interpreter. So after you have seen a doctor, where do you get your medicines? Another member of the primary health team, alongside your family doctor and practice nurse, is a community pharmacist. They can be found in a pharmacy or chemist, often close to where you live. They are highly trained health professionals who can give you trusted health information and advice. For the majority of medications, you will need to go to your family doctor first. You will be given a form called a prescription. Take this to a pharmacy. The pharmacist will explain when and how to use the medicine. There will be a cost, usually $5 for each prescription if you're eligible, but some may have a higher cost. Prescriptions for children under 13 are free at most pharmacies. You may be eligible to apply for a prescription subsidy card once you've paid for 20 new prescription medicine items from the 1st of February each year. For international students, your medical insurance will cover any prescriptions made by your family doctor, which your insurance company will reimburse you back unless it's a pre-existing condition. So get to know your local pharmacist. Now I've talked about where to see a doctor or how to get your medicines, let's talk about some of the special funding schemes we have here in New Zealand if you're eligible. The first is the zero fees for under 13s. If you have children from the 1st of July 2015 and you're enrolled with a family doctor, children under 13 can get free face-to-face visits at most general practices, free prescription fees and free after-hours care, If you are not enrolled, you may pay for the GP consultation. The second scheme is the Community Services Card, which can help you and your family with the costs of healthcare. You can get cheaper costs for GP visits, prescriptions, out-of-hours private doctor visits, and other services. Here is the criteria if you're eligible. You can also go to the Work and Income website or call their hotline number. The third scheme is the High Use Health Card, which can lower your cost to see your family doctor if you have a particular condition and need to go to the doctor 12 times or more in a year about that condition. Talk with your doctor to see if you can apply for the card. In New Zealand, the government runs a no-faults insurance type scheme known as ACC, or Accident Compensation Corporation, to cover the cost of any accident you might have while in New Zealand. This scheme applies equally to Kiwis and foreign visitors such as international students. If you see the doctor with an accident-related matter, it is important to let the receptionist and doctor know that your concern is accident-related. What it will mean is that you can get lower costs for accident-related consultations. However, if you have medical insurance, it will also help to talk with them about what they will reimburse if there is a co-payment above what the ACC will pay. If you need language support, you can also call ACC directly and they will provide an interpreter for you. Let's now talk about the health of your family. Your local family doctor or GP is the most important person for your family's health needs here in New Zealand. Your doctor can help connect you with many family health services such as maternity care and child health. Children's services can include the following. Well Child Tamariki Ora service will support you and your baby from birth up to 5 years. This is a free service to all children living in New Zealand and it doesn't matter about your visa status. The Before School Check is a nationwide program offering a free health and development check for 4-year-olds. Immunisations. It is best to immunise on time, every time, but it's never too late to start. And accessing the right disability services at the right time is very important. Let's now talk about our teeth and oral health. Looking after our teeth is just as important as the health of our body and mind. New Zealand offers a free public dental service to children from birth up to their 18th birthday. You can ask at a school to register your child or call the 0800 Talk Teeth number. Dental services are not free for adults. To find a private dental surgery in your area, go to the Dental Council website. Costs will vary between dentists, so search around to find one that suits you. If you have a community services card and you need emergency dental treatment for relief of pain, you can visit the public oral health services run by the Auckland DHB. This is only for an emergency, so no routine dental service will be provided. Fees may apply. Let's talk about your rights. You also have the right to be treated with respect by health providers. If you have concerns or wish to complain, contact the organisation that provided your care or the Health and Disability Commission, known as HDC. Go to their website or call their free number. It's always important to be prepared when you visit any health professional. Ever left thinking, what did that doctor say? What do I need to do next? Try using the plan approach. P is prepare for your visit. L is listen and share. A is ask questions. And N is note down next steps. By following this plan, it can mean better care for you and for your loved ones. So you've now come to the end of this video. The take-home messages are: firstly, your family doctor or GP is the first point of medical treatment. Find someone who is the right doctor for you and you feel comfortable with them. then enrol with the medical centre. 2. Get your health checks done regularly. 3. Know where to go when you're unwell or if it's an emergency. So our family doctor first, or our private after-hours A&M clinic, or our public hospital emergency department for an emergency. Call the Healthline number if you're worried or unsure and want to ask a question. And 5, it always pays to be organised, so plan your visits, PLAN, so you can get the best out of your time when you talk with a health professional. Lastly, use an interpreter if you need language support. I hope you have found the information I've shared about the New Zealand health and disability system helpful. Thank you. Now it's time for you to share what you've learnt with your friends and family so we can all live well, stay well, and get well.